Hey guys, so I wanted to do a quick little video for you regarding the syllabus addendum for NUR 113, Family Health Concepts. I don't want to waste much class time going over this because we have so much information to get through, but I decided that if I do a video, that would probably help you guys out. Of course, if you have any questions or you don't understand anything, you can always ask me after class or send me an email, and I'll be glad to answer any questions. I encourage you to read the syllabus and follow it because obviously it will help you be successful in the class. But anyway, before we get started, check out my little Halloween lady over there. Isn't she cool? Okay. All right, so you should be able to see the syllabus on your end. Of course, it starts out with a welcome, class time and place. Here are my numbers. You can see my office number here. I have given you my cell number and my home number. Please be considerate. If you need to use either of those numbers, use them for emergencies if you need to, and be considerate of the time. I do have 4 kids, so if I'm not at work, I'm usually not working on school stuff. I'm working on home stuff. My office hours are attached to the Moodle course site, so you'll be able to find those there. You will have the same clinical instructors as we had last time, with the exception of Miss Elkins will be taking over Miss Shelley's group from last semester. Your clinical times are actually 6:30 to 2:30 this semester. The syllabus does say 3, and originally it was 3. But we are going to be backing up to 2:30 on clinical days because we're going to do an upfront skills day on the 19th, and it's going to count for some of your clinical hours. So I was able to shorten your clinical day, and I hope that helps some of you out. All right, your required textbooks are going to be your ATI, maternal newborn, and nursing care of children, and then, of course, your Pearson concept books. We will use the skills book in this class, so that's not one that you are used to using in your other classes after Miss Thompson's, but there is some OB skills, particularly when it comes to assessments, in the skills book, so you will need to pull out and dust off your skills book from Miss Thompson's class. All right, learning environments, you can read through that. Same thing with teaching strategies. In clinical, you are going to have several assignments to turn in for me. You will have a limited time frame to get the information for these assignments, so whatever day that you are scheduled to go to OB on during your clinical rotation, make sure that you take your care plan and make sure that you gather your information for that care plan during that clinical day. You will not have another opportunity to complete this care plan other than that one day, and it is a clinical objective for this class. I cannot be more clear with you about that. You have to meet your clinical objectives to pass the class, no matter what your grades are on tests. So because this class is so large, you have one day to rotate through obstetrics. And unfortunately, whenever there is a large class, that just is how it is. I can only rotate people through one time. So make sure that you gather your information and can complete your care plan satisfactorily on the day that you rotate out. Listen to that again. If you did not hear me clear enough, rewind and listen a second time. You will also be responsible for completing an Edinburgh postnatal depression scale screening, a Ballard assessment tool, on the days that you do your mother-baby nursing care plan. That seems like a lot, but those two, the other two items, the depression scale and the Ballard assessment tool, are very quick assessment tools that can be done when you do your assessment. Those should be completed prior to leaving the floor. You cannot do an assessment on a patient if you wait until you get home. It has to be done while you are there. The care plan, of course, you can collect your information for and write that up later, but the Edinburgh and the Ballard have to be done that clinical day and turned in at the end of the day. You will be doing a pediatric concept map. More than likely, this is going to be completed on your simulation day. We'll get more into that during class. This changes from semester to semester. You also will be required to do a teaching plan for a family. You can do this on a med-surg patient. You can do it in OB if you want. But there has to be a family member present. You have to teach them about something that is going on with their care. If they have diabetes, you can teach them about diet. It has to be related to what they are in the hospital for. This is what we do as nurses. We educate patients to try to improve their health. And for this course, Family Health Concepts, we involve the family in that teaching. So you will be doing a teaching plan and you will implement that plan. And then what you will turn into your clinical instructor is a reflective journal about that teaching plan. And there are questions, specific ones that you will be answering regarding your plan and how you implemented it. Okay. For this course, we will not be doing a group project, the health promotion teaching project. We will not do that this semester because of COVID. All right, and then obviously other work is assigned by your clinical instructor. Some of your clinical instructors will require you to do concept maps each day, and that is their prerogative to do that. Okay. You can read about the inclement weather policy on your own. Same thing with the required supplies and additional information. I'm going to let you go through those. They are pretty standard things from course to course. In this class, you are going to have one ATI proctored exam. There are some practice exams also for this course that you can do as well. I can open those up a little towards the end of the semester. There's a maternal newborn and a nursing care of children exam that you can do practices on. Hopefully you guys are in the cohort that have access to that. Otherwise, there will be a practice exam for the level 3 proctored exam, and you will be doing the level 3 proctored exam on campus at the end of the semester. There are 3 tests in this course and a final exam, and you can see where those are placed when you access the course calendar through Moodle. Of course, you have to have a final course grade of 77 to move forward. Your 3 tests count as 70% of your grade, and the final exam counts as 30% of your grade. Same as in your other courses. All right, we're going to move through this because I feel like you guys can very much read that. This is the standard course agreement for NUR 113. This is attached as a separate document in Moodle. You need to print it, and you need to sign it, and you need to turn it in to me. Those of you who are virtually learning can download this, type your name into it, and email it to me. If you're not, actually, I would rather you print it and sign it and bring it to me along with the honor code, which is also posted as a separate document on Moodle, and bring it with you on the first simulation day. That way I have a signature from everybody. All right, so I have a nice little grid here. Hopefully that will help you stay organized in terms of your reading in the course, and I'm going to talk about how this grid is set up. So the course is broken up into modules like most of your other courses have been. HCM stands for Healthcare Module 1. These course modules are the things that I am required to teach you about according to the Board of Nursing. I have sort of cross-referenced those over into what module they fall under in the Pearson text. And then I've listed out the exemplars and the topics that are included in those modules that we're going to talk about. And then at the very far right-hand side of this grid, you will see the page numbers in your Pearson book that are required readings, okay? If the page numbers are in bold, those readings are required of you, okay? If the topics or the exemplars are in bold, those are the things that I am absolutely required to teach to you by the Board of Nursing. Now, of course, there's additional information in here. Any page numbers that are not bolded are page numbers that will help you if you read those. So they are just an additional resource for you to further your learning. Okay. As you go down, you can see that the concepts change. IM stands for individual module. Again, you'll see the exemplars, what the concept is, and page numbers. Okay, again, the bolded page numbers are required readings. And if you forget that, as we scroll down here, I have it listed at the bottom of the table. Page numbers in bold print are assigned readings for this course. Also, this grid does not include the assigned readings from ATI. Those are under each individual module. I'm getting ready to show you that. Okay? All right, so we're going to go through just one of the modules so that you can see how things are set up. And then I'm going to scroll to the end of the syllabus because the following pages that are broken into modules are set up exactly the same. So the first module that falls in this class is Healthcare Module 1. And what's included in that is safety. So you're going to find the concept under the module, and then in parentheses you will find specifically what we're going to talk about as far as exemplars are concerned related to that concept. All right, so for safety, we're going to talk about health promotion and injury prevention across the lifespan. We're going to breeze through that because you've already had it in Ms. Thompson's class. We're going to talk about anticipatory guidance, and again, we'll breeze through national patient safety goals because you get beat to death with that as well. But we're required to teach it to you. All right, so under that, you're going to find a description of what all of those things include. You can read those each week before you do your readings to help you sort of focus your learning. I have listed all of the objectives or the learning outcomes for each of these areas that are required under the exemplars, okay? Little hint, the majority of these come straight out of the book. So those are marked at the end in parentheses. All right, so you can see we're going to do health promotion and injury prevention across the lifespan. Here are your learning outcomes for that. If you scroll down, here's anticipatory guidance, which is the next exemplar under safety we'll talk about. Then we have national patient safety goals, and there are the outcomes for that particular exemplar as well. Under the learning outcomes, you will always find your learning resources. So your textbooks, any websites that I think are helpful for you to study, And then you'll find learning activities. You can click on these websites and go straight to them. You probably will have to right click and then open in a new web page. The learning activities are broken into 3 different categories. There are pre-class readings and assignments. These are things you should be doing prior to coming to class. It will help you follow along, and it will help you understand what I'm talking about, particularly whenever we start talking about sexuality and reproduction. If you do not read before you come to class, you are going to feel lost. All right, in-class objectives and assignments and/or activities. So these are learning activities that possibly we will do in class, with half of you being at home and half of you being in class. I very seriously doubt that we are going to be able to do a lot of these, and the majority of this class is going to probably end up being lecture style, just because of the circumstances that we're in. However, if you can utilize these in-class objectives and assignments and activities while you're at home studying, or have these things in front of you as I'm talking and be thinking about this information and writing yourself some notes, it will help you in the long run if these are things that we're not able to do during class because of time constraints or COVID or whatever. The third section under learning activities are in-clinical activities. These are things that you should be looking for or attempting to find information to throughout your clinical day whenever we are going over this information. This will help you pull the concepts of what we are talking about in class into the clinical setting, and help you bridge that gap between class and clinical. And that really is ultimately what we're trying to do, right? We're trying to create nurses who can take the knowledge they've learned in school and apply it when you're taking care of people. So that is why I've included the in-clinical activities. Utilize those to help you. Of course, your evaluation of learning really is mainly going to be based upon your unit exams and your final exam, but there will be times where when we have skills day, where you'll be return demonstrating things. Also in clinical, you will be demonstrating skills. You'll have your clinical performance evaluation, your midterm and your final, and then class participation as it applies. So every module in this class is set up in that way. I have tried to make it easy for you to follow, and I have tried to break it down and keep it organized, because I do realize that you are all very busy, and the more organized I can give it to you, hopefully it helps you stay organized and on track. Try not to fall behind in this class. All right, we're going to scroll down to the end of this document. Sorry if I'm making any of you dizzy. Look away. And we're going to talk about what is at the end here. All right. Okay, so these are the specific requirements for written or oral work in this class. For your mother-baby nursing care plan, you are going to write out this care plan, and it is also linked as a separate document on the Moodle site. You can print it from there. It is very long, but do not let that don't let that discourage you. Okay. It has a little bit different information than what a normal care plan would have, a little additional information, because we're taking care of a different population of people that require different types of assessments. So you're going to do this care plan on a mother-baby couplet. All right, this is somebody who's already born. We're not doing this on a laboring patient. We're going to be doing this on a mother who has already had a newborn. So you'll be taking care of a mother-baby couplet, and you will be finding information on that couplet to complete your care plan. You have to list your comprehensive assessment data. You have to develop a comprehensive list of nursing diagnoses. You have to have at least 4 that are appropriate for the mom and the baby. You have to have at least 2 for the mom and 2 for the baby. Okay? 2 nursing diagnoses for each of those patients. I will tell you this can be a little difficult because a lot of the times the patients you take care of are pretty normal patients. They're healthy, they don't have a lot of problems. So sometimes in mother-baby care we have to focus on the psychosocial aspect of things. If you're not finding physical, if you're not able to find physical diagnoses to put there. But talk with your clinical instructors and they can help you, and I'm always a resource, obviously. Okay, you have to put your diagnoses in order of priority. That's no shock to any of you, I hope, by now. Also, you're going to develop outcomes for each of those diagnoses that are appropriate. They have to be measurable, quantifiable, calculable. They got to be able to be gauged, accessible. Think about all those things when you are writing your outcomes, okay? And make sure that you are reflecting a reasonable time frame for your patients to accomplish those outcomes, okay? Your listed nursing interventions, you can have no less than 12 of those between the 4 diagnoses. So you have to have 3 interventions for every diagnosis that you write. Okay, they have to be appropriate and specific to your client and the support system, and they have to relate logically to the achievement of what your desired outcomes are. Okay, don't just willy-nilly copy something out of your care plan book and slap it down on your mother-baby nursing care plan, because all that tells me and all that tells your clinical instructor is that you can copy some words down and plagiarize a book, all right? You need to be making sure that what you're writing on this care plan is specific to your patient and that you have actually given some thought to it, all right? I don't want to see anybody copying anything out of a care plan book. Make sure that you are describing your rationales for those interventions. Any references that you are using do not need to be older than 5 years. Make sure you're listing the medications on there as well. Okay, there's some specific things for the meds. Same thing with the labs and ordered test results. If there are test results that have been done and results are pending, you can write that down. Many newborns have a test called a PKU that's done before they go home, and you won't see results of that test before that baby is discharged. So if that's a test that you need to write down under labs, then include that, but just put the results are pending, okay? All right. The Ballard assessment tool is also linked as a separate document on Moodle. You can print that off. That will be due, as I said, at the end of the clinical day that you performed that assessment. This cannot be done at home, because if you do this at home, then you have falsified the documentation that you have turned in, okay? You can't do this on a virtual patient or a previous patient. This has to be done on the newborn that you take care of during the day. There will be a nurse that can help you move through this, and there's also a video under your clinical resources that Ms. Edwards did showing you about a Ballard. We're going to talk about it on Skills Day as well. The Edinburgh postnatal depression screening, also linked as a separate document on Moodle. You need to print this out. This is a very easy assessment thing to do. You hand it to the patient fills it out, and you score it up. It really is that easy. This is another one that has to be done that day and turned in by the end of clinical. You cannot do this one at home because your mother actually has to fill it out. Okay? We'll talk more about this one on Skills Day as well and what needs to be reported. The concept map for the pediatric client. You guys will not be going to the PEDS unit this semester because of COVID. I have some clinical sites that we are not able to get into. I have several clinical sites where we're not able to get into the pediatric unit to be able to accomplish this. So probably we are going to be doing this on Pediatric HAL in the Sim Lab. So we'll be doing this together, and we'll talk about that more on Sim Day. Brush up on your fluid maintenance requirement and safe dose calculations, because those are something that will be required on this concept map. All right, so here is the implementing a teaching plan, the reflective journal writing. During this experience, you're going to be required to implement a teaching plan that's directed towards the family. It has to be specifically related to that client and needs that they have while you're taking care of them. It can address any issue regarding care or education, but it has to include the other family members involved in the client's care. And when providing that teaching, you must remember to perform a family assessment and implement the teaching plan effectively for the individualized family dynamics that you have assessed in that family on that clinical day. This has to be submitted in a typewritten journal entry, no longer than 1 page. And it has to include the following information. You have to tell me what family members are involved. That's my husband's grandfather clock. All right, you have to tell me about the family members involved. Do not include names, obviously, only family memberships. You got to talk about what subject you taught and why. Describe the family assessment that you completed and specifically include what family dynamics that you observed. How do those dynamics play a role in the client's care and why is that important? Describe how the teaching plan was individualized regarding that specific client and the family. So what did you do to personalize it to their situation and the assessment and the dynamics that you observed? And then evaluate the outcome of that individualized family teaching plan strategy. Was it effective? Why? Why not? And what did you learn from the process? How could you improve it next time? Okay, and why? All right, so for assignments, all work that is submitted needs to be professional in manner and appearance with correct grammar, sentence structure, and page formatting. You guys are getting ready to graduate, and this should not be a problem for anybody. Everything turned in should be professional in the way it appears and in the way it is written or typed up. Typewritten papers need to be in 12-point font, 1-inch margins. Go back to your APA format and refresh your mind on that from English 111 and 112. Handwritten assignments need to be turned in black ink. They must be neat and they must be legible for you to receive credit. And remember to save a copy of assignments for your records, okay? The computer lab is available to anybody who needs a device to type your assignment on. So just remember that. Okay, the Health Promotion Teaching Project. This is not a required assignment for NUR 113 Fall 2020, so we are not going to go through that. All right, and that is the end of the syllabus. Obviously, if you have any questions, you can reach out to me. I just did not want to waste our precious class time going over something as mundane as the syllabus whenever I felt like you could watch it on video. I'd rather spend my time teaching you what you need to know for your test to be successful. Okay? All right. I can't get this thing to cut off. Seriously, how can I stop it? There we go. It was hidden. Bye, y'all.